lawyers are so important in a startup innovation, especially in AI, as you'll see with the current complexities of AI framework and rollout. And we're certainly thinking about class 1, class 2 as being what AI will be going forward, how we implement change. So thanks for that kind talk. So in the audience, how many of you have the NHS app? Hands up. Hands up, go on. How many? Who has the app? Should be all of you. Who doesn't have the app? Put your hands up. Okay, great. So look, one of the great things about the UK, I do, as you know, spend my time traveling around the world, giving keynotes, speaking. One of the few things that people are impressed with the UK still is the NHS app. The fact that back in 2019, in January, we launched this amazing app to the world that was available to everybody to access some of their health data. You can't imagine the interest and respect the NHS suddenly had amongst many countries. Of course, other countries now, of course, have their app, their platform. Here's mine. Good afternoon, Shafi Ahmed. I've just accessed it today. I use it all the time. And of course, you saw the recent headlines of how it's going to be developed further, how much more can we integrate into this app, and hopefully that's the conversation we'll have coming up. Have you heard of WeChat? Who's heard of WeChat? So WeChat is the app in China that's used by 1.2 billion people that integrates all of your data in terms of healthcare records, accessing insurance, accessing appointments. Whether we go down that path, who knows? But the NHS app is certainly, I think, a beacon of innovation that we should be proud of. And I want to hear more about this. And this is going to be an amazing panel from Joe. Joe, the floor is yours. Thank you so much.
Excellent. Thank you very much, Shafi. Can I ask my colleagues to come up and join me on stage? Welcome. Congratulations. Congratulations to the audience for joining the panel of Giant. You've got to start somewhere, haven't you? But in all seriousness, you are joining a panel who are part of the most successful digital program the NHS has ever seen. October, 55 million logins, just over a quarter of the entire country's over 13s logged in. And these are the guys that are making it happen, okay? What I'm going to do is I'm going to get them to introduce themselves for a couple of minutes each, then ask them some really difficult questions, and then my expectation is the audience, that's you, are going to be amazed, wowed, and ask some equally difficult questions. And that's my job as chair, okay? So, I'll start off. Let me introduce you to Peter. Over to you.
Thanks very much, Joe, and welcome, everyone. Nice to see you all. So I look after three things within NHS England. Number one, ERS, the referral service, which is in every GP surgery in the country. Two, booking and referral standard, which is looking at how we standardise clinical and non-clinical referrals. And then Wayfinder, which basically connects secondary elective care to the NHS app. The way we do that most of the time at the moment is via patient engagement portals. I'm here because what we want to do is start to have or continue to develop an end-to-end journey from point of referral to end of treatment. And we want to talk a little bit more about what we've achieved and how we're going to do more of that. I'll hand over to Francesca.
Hello. Hello, everyone. I'm Francesca Markland. I am not part of the NHS App team, but I am part of NHS England in the London Digital Transformation team. I look after remote monitoring and virtual wards, but I'm also interested in more broadly in what we can do at home for patients to do within their own homes. And the NHS app is obviously a really important tool in that. And I'll be talking a little bit about some of the opportunities to integrate remote monitoring with the NHS app and what that might look like in the future for us.
Thank you. Great to be here. So my name is Ben Cook. I'm Deputy Director of Product across the NHS app, but nhs.uk as well. And yeah, I think it's really exciting to come here and talk about, Joe mentioned the 55 million times the NHS app was used last month. Behind that, we're seeing more and more people manage everyday healthcare needs at home. So 35 million messages, 20 million times that people view their GP record and test results associated within that. 4.7 million prescriptions ordered, which is taking kind of interactions into people's homes and away from the front line and taking some of that burden away. But it's just really exciting today to come and talk about some of those things, the trajectory we're on, and also have a bit of a horizon scan and talk about, with the work that's happening in secondary care and in the trusts, what are the innovations that you're all working on, and how could they connect up different pathways to deepen that engagement with the NHS and make it even more of a transformative force in the future?
Okay, so you hopefully now know what they do. And I'll start off by saying you've got lots of people in the audience from the private sector. What do you want from the private sector to make the NHS app even more amazing? Peter, start with you.
So I think from my perspective, what we're trying to do on the Wayfinder side at the moment is be really transparent about what we want to do in the future, and then how we can work with the private sector. I think we would be wrong to think that we can run faster, we can do everything, we can do what entire markets are currently doing in pockets with trusts at the moment. And so really from my perspective, I really have a sort of mental model where we've got private sector working with trusts on an initially small scale to test new innovations. I just want to learn from that as much as we can. And as those things mature, they sort of become commodities. We need to look at how we bring them into the NHS app. To start with, that will initially obviously be messy. Things will have been developed in different ways. But we need to understand that at some point we want to standardize those things. The example I talk about often is viewing appointments. You know, there was a time when viewing your appointments via a mobile phone was an innovation that was unbelievable. Now it's something we think everyone should be able to do. And so we're at a point where we want to standardize that. So I think it's about going on that journey from innovation through to standardization.
So does that mean, Ben, that the NHS app wants to take the IP, having just heard about patents, take that IP into the NHS app and steal all these brilliant ideas from innovators?
Absolutely not. So I think there's a real partnership role here. I think there's a lot of talk about the technology, and there's a lot of, you know, if you're looking at AI as one example, there's a lot of deep expertise in those technologies that we don't have today, nor do we want to go and build that domain knowledge from scratch. But I think one of the reasons it's more than just IP is going, well, actually, the innovators here know how to go and apply those in health systems from around the world. They have that knowledge of, actually, how do you get value out of this as opposed to just taking a piece of technology? So the short answer is no, but I think we wouldn't be successful even if we just had the IP, because it's how do you take that to market? How do you do that innovation? How do you bring patients, clinicians, the whole ecosystem along the way and drive value from that, which is more than just the technology and the IP? And I think you've done a load in this space, right?
Yeah. Happy to add to that. So yeah, I think you mentioned the magic word, or the word of the moment, which is ecosystem. I think everyone's quite excited about our digital health ecosystem at the moment. And that ecosystem is made up of NHS managers, providers, clinicians, and all of industry and all the great minds that go into making the innovative solutions we see. What I would say about our role in the NHS and the NHS app as the digital front door is that there's a certain element of gatekeeping there, or that needs to be there. And that's really important because the NHS have a set of values, and I won't go into it, but there's been some high profile cases of late where the values of a supplier have not been in alignment with the values of the NHS. So and as we see more and more suppliers in this space, one of the things that we'll need to do from our side is just be really mindful of our NHS values and try to work with suppliers that are aligned with those values. So to industry, I would say, be aligned with our values.
And Francesca, how do people in the audience sitting there thinking, this is the first I've heard of this, how do I find out whether I'm aligned or not? How would you support that?
So I have a look at NHS, sort of our central website, and have a look at our kind of values. But I think from a corporate perspective, you'll hear, so the bigger companies will have whole teams and sections dedicated to corporate responsibility and how to demonstrate social value. And you'll actually start to see, I think when some people write some of their bids, that's something that they would highlight in there. So moving forward, I would say, think about that, continue in that vein, and broaden out how you, as a company and a supplier, no matter the size, what's your bit for corporate responsibility? What's your bit to add social value? And of course, be inclusive. Think about how your product can meet everybody, or as many people's needs as possible. So being inclusive is a key part of our values.
Okay, there'll be people in the audience thinking, well, I do all of that, and I tick all of those boxes. Pete, why can't I get into the NHS app with my amazing product?
Well, I can answer the bit for secondary care. I think one of the things we it's a double-edged sword, or two sides of a coin. We're very lucky that so many people want to get onto the NHS app, that people approach us. And the reality is we do not have the resources to bring everyone on board all the time. And so what we have to do is really be quite strict with what we're aiming for. So everyone in this room who works in tech will be familiar with the fact that it's probably now a bit easier to actually create nice, shiny apps, features, do things with AI than it is to actually change outcomes. And so what we're trying to really focus on is have a laser focus on outcomes. You would have heard the PM and others announce the priorities, the return to 18-week RTT. And what we do when we talk to suppliers is try to work out how their products help our priorities, and then stack them up against that basically, and work out how we can integrate. So we just don't have capacity to do everything, is the short answer.
So coming back to Ben then, what would you do if you were in charge of the NHS for a day with digital funding? I did say I'd give him a hard time, so we may as well enjoy it.
It might need more than a day, and I think one of the big things is consistent, predictable funding. That's one of the big enablers, is going, if we unlocked a load of funding in a day, great, we need to know where we're going and invest in that whole ecosystem. I think if we look at the three missions of that, move towards digital, neighbourhoods and prevention, they're really big things, and it's about how do we fund those things whilst managing the day-to-day pressures of the NHS, and I think that would be the one thing I'd unlock. How do you do a lot of funding now, understanding that there are still those everyday pressures? I think the big thing is not investing in those innovations in a silo. So it's going, if you're looking at prevention, what can some of those technologies, capabilities, pathways unlock in secondary care? What can that unlock here? How do we spread one benefit across more than just one pathway, and open that up to trusts, regions, neighbourhoods across the country to all benefit?
And
Can I just add
Francesca,
to
you
that?
coming? I was going to say, I think you probably want to come in.
Yeah, no, I think that you hit the nail on the head. We fund in silo, but we're procuring products that deliver benefits in different parts of the system. So we need the way we fund to reflect that. The other big thing around funding, and just talking to someone about this just before now, is capital versus revenue. And it's a problem, it's a challenge. Lots of capital funding, lots of revenue products, if you like. So we need to rethink how we distribute the funding and how it's allocated, especially in this digital health space.
And then maybe just to add my comment in the end as well. I think one thing we've really learned through Wayfinder is we often get feedback from trust partners where they're working. If they want to go faster, in some cases they've got the tech there, but they cannot implement and make the changes fast enough within the trusts. And I think one of the lessons we've learned the hard way, and we're doing more of, is funding that change, that process change the mentality, both with clinicians but also patients.
Okay, just before I open it up to the audience, I'd like each of you to say the one thing that you're proudest of, that you've achieved so far in the development space, and then secondly, something that's on the roadmap that you can just tempt our audience with that's coming. Would you like to kick off, Ben?
Yeah, it's a really good one. So I think the thing that I'm proudest of, so the NHS app is growing like an absolute rocket ship, and that's a huge source of pride. I think the big thing that we're focusing on is creating a more consistent app experience and creating that coverage. So it's great that people can get access to their GPs. Can we get more people able to do everything on the app in secondary care, primary care, to that consistent level of coverage and experience? The fact that we're starting to get towards that now, I think, is a real source of pride, because it means that you can really drive those kind of expectations of the population. What's coming next that I can talk about? I think the big thing is probably looking at the neighbourhood model and going, how can we work in an innovation space with trusts and kind of local areas to help them think about how do we help route the capacity to where the need is, and again, give those capabilities into their hands as opposed from us managing that from the centre. I think that's the big unlock for next year.
Excellent. Just before Francesca comes in, the thing that I like there is that Ben had to really put some thought into what he was allowed to say is coming next, because there's so much stuff going on behind the scenes that we will over the next few months announce, but haven't yet got to a place whereby we can announce. So well done for saying that. Francesca, over to you.
Thanks, Ben. Okay, so not talking about the NHS app, but talking about remote monitoring, one of the things I'm proudest of is the way we were able to look after care homes, patients that lived in care homes during the pandemic when they were our most vulnerable. But also that work was recognised by the UN, the United Nations Global Report on Healthy Aging, as one of the examples of a positive way to use technology to improve the way that we deliver care in care homes and keep people safe and well. One of the things on the roadmap that I'm excited about, which I'm not sure if I'm allowed to say, I'm going to just say it.
Blame me.
Is that we're going to be doing an integration with some of the remote monitoring supplies for virtual wards technology, and that is going to be a first of type, I believe. So it will be really empowering from a patient perspective because you're at home, but you know that you are a patient on a virtual ward. And now through your NHS app, you'll be able to see all of those observations that your blood pressure and whatever else is being taken through the NHS app. So that will be fantastic.
Yes.
So from my perspective, I think the things that I'm proudest of looking at it from a wayfinder connecting secondary elective care to the app is scale. So we're from a standing start. In 2 years, we've connected 101 trusts to the app. We're going to have full coverage of acutes by the end of next year. But what does that mean in terms of outcomes? We're on track to have helped trusts avoid 2.5 million DNAs by March next year. Hundreds of thousands of people who don't need to be on wait lists have been removed from that. So I think the impact is just really clear. I think I'm also really proud of how we've done it. Every month we have forums, open forums, where between 50 and 100 trusts will turn up, tell us what they don't like, tell us what they do like, and we do it as a partnership. And we're starting to do more of that with patient engagement providers and other software providers as well. And for me, it feels really like the ecosystem that we were talking about is more than a buzzword. We're starting to really make it happen. And a tangible thing that I'm excited about next year, so not sort of going too far off into the world of what we're not allowed to talk about, patient-initiated follow-up. So we know that it happens. We know that it has impact. I think there's about 3% of people at the moment are put on PIFU pathways. We've seen examples where 90% of people on a PIFU pathway or digital PIFU pathway don't need their follow-up appointments and never had them. So there's a really big opportunity there that we want to look at how we can start to standardise that within the app and across the country.
Brilliant. Thank you very much. I will now open it up to the audience, and I hope that you've got questions prepared. Who's going to be first? Gentleman at the back.
Can I just ask a quick question before they
Go
start very quickly? Thank you so much for that. So how long before my Aura Ring or my wearable is connected to the NHS app? Francesca, I'm looking at you. Look at you, Francesca. It's like a redaction of so many comments here. It's like, how can I get some information out of you? Any ideas?
What I would say is it depends. These guys will need to tell you about the integration, but I would say the point that I made about earlier, which is around we can't integrate everybody. So I'd need to know why your our Aura Ring, what clinically useful data is that providing that clinicians want. So what's the problem we're trying to solve? If it's helping you to sleep, that's great. Does that need to come through the NHS app? Not sure. If it's got clinical evidence, outcomes and information, then there's definitely an argument for it. But we do need to pick and choose because, like you said, we can't integrate with everyone.
That's such a politically correct answer. I was going to say if we get enough money. So well done, Francesca. Right, to the gentleman at the back.
Thanks very much. Very exciting, and I'm Chris Bourne from Healthcare UK. It's a fantastic thing, the NHS app, and we're right to
Sorry, there's quite a lot of background noise coming this way.
I'll bring it up closer. Is that better?
Perfect.
Sounds very loud to me. It is a fantastic thing, the NHS app, and we should shout about it. You're quite right. I think the standardisation point is really important. So for those of us who still can't access our GP, we still can't put together a single medical record off the app. At least I haven't found a way. Maybe you can tell me there is a way. So there's a lot of other people are put off by it because some of those basics aren't there yet. So I think the standardisation is really important. The question I had, given you had so much interest internationally, have you got the capacity, are you interested in offering advice, consultancy, maybe even selling some IP to other governments or healthcare systems?
So if I start and then I can bring in the team, you must have been tracking me because I was at the Danish embassy only last week talking to the Danish team about the work that they're doing over there. We know the Australian government, the Dubai government, a couple of other Scandinavian countries all see what we're doing with the NHS app, all want to understand what they can copy from us, but also what we can learn from them. So I think there are absolutely synergies there that we can work with. And for me, it's the capacity is going to be the only thing that stops us. Technical teams are doing it day in, day out anyway.
Hi, Lisa Goldstone, EY. So there are more trusts going Epic, which is a good thing and a bad thing given the patient portal scenario. So how are we working with large tech vendors who might not be UK-based?
Do you want to say that?
Yeah, topical. So I am working really closely with Epic, and more importantly, Epic Trusts, or all the trusts that have got Epic at the moment, to find a way. I think it's fair to say we have been through a period of a challenging period. I think over the last 6 months or so, what I have observed and been part of is that NHS England and NHS Trusts coming together with shared vision and then approaching the suppliers and saying, hey, we've trusted amongst ourselves. This is what we think is best for patients and for clinicians. How would you like to support us on that journey? It's helpful. My experience working with Epic during the last couple of months has been that they will listen, they engage, they want to do that with us. So from my perspective, it's about joining up as an NHS first and then trying to find finding a single way into suppliers.
So I know your question was about large tech vendors, but just to sort of SMEs as well, and to your point earlier about we can't integrate with everyone, seek partnerships, because where there are, so patient engagement portal was a good example where they've already got integrations with the NHS app and EPRs. Seek partnerships, because if you've got a niche product or service that needs to be surfaced on the NHS app but can be done through a patient engagement report, for example, then that doesn't need to be a blocker that you can't have a direct integration. So again, collaboration, consortium approaches are great.
I also think that Epic happens to have been the epicenter of the recent focus on engaging with the NHS app. I think we have to be fair to our suppliers who have seen a number of initiatives come through the NHS over the last 20, 30 years. And it's not surprising that some will be reluctant or reticent to jump on board straight away. I think it's fair to say that our suppliers now, our major suppliers, have seen that the NHS app is successful. It is here to stay. And the only future is to integrate with the NHS app. And I think our suppliers have heard that now. So I think we will get through this quite reasonably.
Hi, I'm Rena Zaki. I'm a PhD student studying how health tech companies are moving towards the NHS. Thank you for your talk. So Francesca, you mentioned that industries have to align with the NHS values, but I'm noticing there's also movement towards publishing APIs, and it seems like developer communities can build their own products that add on to NHS infrastructure. So how do you manage, because it seems like they can just sign up and get a certificate, but how do you kind of manage them or review them, I guess, if that makes sense? Thank you.
Could I add to that? Why isn't the NHS app open source?
It's a really good question. So you're seeing, technically it's really easy nowadays. We could publish some open APIs and just let anyone play. I think it's about maintaining really high standards and also having a predictable managed marketplace. So if we let 17 different providers that might not work with your trust might do to come in and provide a service through the NHS app, that's a really fragmented experience for a patient. So there has to be a level of curation, clinical assurance, all those things to protect patients. So there's a lot of collaboration that our integration team do to work with different suppliers that integrate today to manage the quality of that, to create that standardization. We've got an integration strategy, which effectively says there's 4 or 5 different patterns based on what you want to do to really clearly communicate that. But both for experience, safety, and general kind of commercial reasons, you do have to manage who you want in and who you want out and communicate that clearly.
And just on that as well, I guess back to the values bit, it's around trust. So I think in pretty much every poll done, the NHS is one of the most trusted brands by the British public. And we need to protect that. But the only way we can protect that is by being a little bit gatekeeperish about what we let through. So the NHS app is widely touted as the digital front door. And so we need it to be a solid, secure front door that people feel confident about walking through, and they know that what's on the other side of that front door can be trusted. So I think that's why I'm all for democratisation of data, but we do have to kind of manage the risk and secure the brand.
And just to add to maybe sort of concrete examples of things that we do internally, formally and informally. Number one is when we're looking at integrating partners, what does the end-to-end journey look like from a patient perspective? Does it lead to dead ends? Does it lead to duplication? Are you jumping off into other apps? Because if that's the case, you're more likely to confuse people, and so it's probably not a great thing that we want to support. And then secondly, I think something that I certainly, for me, is always really interesting is what's the business model of these companies? They are companies, it's the private sector, everyone understands they need to make a profit and make money, there's no problem with that. But it's interesting to look at what they're making money from, and often you can tell quite a lot from that.
Lovely, thank you. Who's next? We've got the lady here, and then we've got 2 in the middle over there. Stop.
Hi, my name's Olivia. I'm the founder of Remedy. I was just wondering what your key areas of prioritisation are for digital transformation within the app, and how you decide on those areas as well, please. Thanks.
I suppose if I just buy these guys a moment, from my perspective, 2 big areas. One is making sure the NHS as a service adopts what is available presently, and we still see huge variation across the country in that adoption. And secondly, coming back to Francesca's point, how do we publish the roadmap that shows where the best interventions are going to be over the next couple of years? And in order to do that, Ben's point about consistency of funding and knowing that we're not just going to go year to year to year, but we have a 3-5-year cycle of digital investment will allow us to do that. I'm not sure that we're there just yet, but Ben.
Yeah, 100% agree with the first one. I think there's a lot of transformation that we're talking about, but the biggest investment I think we'll make in the next year is continuing to grow that scale and consistency. So going, how do you get everyone able to know how to book a GP appointment through the app? How can they then go and understand how to engage with their acute trust to go and manage any kind of referrals? So it's sometimes worth keeping an eye on that kind of foundational thing is still a really transformational thing for the NHS to have consistency of. I think the missions are probably the other thing to follow. So if you're looking at how do we optimize and digitize certain care pathways and give those capabilities to trusts and regions to go, actually, here's an efficiency that you want to drive in how you work, here's a different service model. I think it's those transformational capabilities in terms of prevention as well. So what can we do around home testing? What can we do around vaccination? What can we do around screening? That kind of remote monitoring. How do we keep people out of hospitals? And then the neighbourhood idea, kind of what does that look like, and how do we work with trusts and regions to go, look, what does that mean for you? Where do you want to put your capacity? How can we help you manage that? I think those are probably the big areas, along with the care record too. That's been spoken about a lot. And we still have to work out exactly how to do that in a way that's beneficial for clinicians and patients, because it's one thing having a database, but having something that's meaningful and usable for everyone involved is a really big unlock. So they're things that you've probably heard, but driving that baseline experience is another one to add.
Lovely, thank you. We've got time for a couple more questions. Let's come over onto this side.
Hi, Jamie here from Avagen. I know you can't accept everyone onto the Wayfinder program, but what is the process of getting on? How long does it take, and what data do you need from us? As we're in quite a few NHS trusts, we help enable PIFU. We're ticking a lot of the boxes that is in waiting list, DNAs, cost saving, but just keen to hear how do we get onto it when you do have capacity?
The shortest of best answers, I'll give you a link to the website where you can sign up. I'll find it afterwards. But what we have previously done is had a model that is about onboarding trusts, or onboarding suppliers that have got a large number of trusts when we wanted to reach scale. As I said earlier, we're now in 101 trusts. We're expanding into mental health community as well. So we are moving away from that and moving into a space where we'll be able to onboard suppliers have fewer trusts. Well, just because we're in a different space. But we've got an online process and form that we can follow.
Just out of interest, have you tried the online process? And again, not wishing to put anyone on the spot, what was the worst bit about it?
We haven't heard back yet. We went through James' friend as well, so he's put us in contact with a few other people who I've reached out to. So
it's not a no. You just haven't got any response back yet.
Yes, and
Okay.
we're keen to know how long. You want to. It's been something we're asked about a lot.
Yeah, so we should definitely speak. There's plenty of people who will stop me getting off the stage and escaping. In terms of how long it takes, really varies between, I think our record is around 3 months in the positive sense, and the negative sense over 12 months. But it really depends on the supplier, but then I would say that.
Thank you. Good question. Gentleman behind.
Hi, Ben Falk. I work at Guy's and St Thomas's. I actually recently made an appointment for my GP through the NHS app, which worked well. I then got the results through the NHS app, which also worked well. As someone who works for the NHS, I hadn't actually appreciated I could even do that. And I think it was brilliant. And I just wonder whether there's going to be more, I guess, comms with the general public around trying to encourage people to use it, or is it that I just haven't seen it? But I feel like it's a brilliant resource that works well. And are there plans to promote it publicly, I guess?
I think I'll save my panel the answer to this one. It's very clear that our citizens as a whole, not just people in the NHS, don't know about all of the functionality that's on the NHS app. It is incredibly difficult to get the government as a whole to spend money on advertising public sector products. We achieved it briefly last year, in January of this year, last financial year. We're trying again really hard this year because there is a direct cash saving to the NHS for everybody that signs up to the NHS app and uses it. So we're trying really, really hard. There is a reticence, not with the NHS to be fair, but more broadly with the government about that public sector advertising. We know the problem. We will keep pushing hard to get it solved.
I think that's 100% right. There is a lot more outbound above the line that we could be doing. That becomes a lot easier once, as we approach that consistency of experience, because you can go out with one message a lot more easily than it would have been 12 months ago when there wasn't as much consistency. Another big thing we see as well is it sounds like you're a frequent user of the app and you're trying to learn more about what else you can do in it. So if you think of other digital services as you log on, what's that onboarding experience? How do we help teach you actually you can do this? It's not come and use the NHS app. It's you're already using the NHS app and there's 2 or 3 other things you can do for it which are great for you. So I think that's another thing that we need to try and focus on in the coming year and go, how do we do that cross-pollination of services?
Just thinking ahead again to the future, I think what we'll see is as we got more of a focus on population health management and how we can use data at scale to really kickstart some of the population health initiatives, then hopefully what you'll see is en masse or at scale cohorts at PCN level or at place level who are onboarded for some form of remote monitoring or other form of interaction via the NHS app. And that will, again, it's going to be comms at a local level. It might be the PCN putting staff up, or it might be the GP surgery. But those types of initiatives should start to bring more people on board in larger numbers as well.
And joking aside, if you're in the audience and you haven't A, got the NHS app, or B, got your notifications turned on, and C, gone paperless, don't come and talk to me. Seriously, because I'm interested in making sure the NHS app is the digital front door to the NHS. And I'm not really interested in people who don't believe in that vision. So there's a message for you. Any other questions before we finish? That's got a few. There's a lady right at the very back. If you go for you, your hand was right up very quickly.
Hi, my name is Maria. I'm a GP, so I don't want to upset the crowd. I've got a couple of questions. I agree with the gentleman that the NHS app is brilliant, and we are using it to access your GP and book appointments and do all of that jazz. Although we're dying and drowning, we'll figure it out. My question is, you talked about NHS values, ethos. There's so many services in the community that have that. I'm talking about our pharmacist, I'm talking about our optician, our dentist, but they seem to have been left behind and they're not quite on the NHS app interface. So when I recommend it, you know, we're really pushing the app, despite working in East London. The patient gets there and realises half the information's not there, so then is like asking us, why should I use this? It's just another thing I have to put on my list. Like, what's the point if all these other services aren't there? Where do you think they will be there, and when do you think that will be the case?
I think we're now straying into territory that Joe advised not to stray into. But at a high level, speaking from a Wayfinder perspective, yes, it's on our roadmap. We can go as fast as we have funding to go for. So at the moment, our priorities are acutes. We're going to get into all of the acutes. We will then be focusing on mental health, community health, optometry, pharmacy. There's work being done around pharmacy first. So yes, that is the view. Very early conversations, but if you expand that view and vision out further, you start to think about local authorities, social care, all of that sort of thing. So it's on people's radars, but we can only go as fast as we've got funding for.
If I can have a slightly shameless plug, I live in East London, so it'd be really easy to come and kind of see some of the services that you're talking about, and we're always looking to learn. So if you come up at the end, it'd be really good to arrange some visits and just understand your perspective from an area that I know.
Great. I think we've got time for one final question.
Thank you for your time today. It's been very interesting. I wanted to ask whether you differentiate or have a different strategy for software companies who are UK-based versus those that come from, say, Europe or United States.
So just so that everybody can hear, do we differentiate between software companies from the UK and those overseas, query US and further? Thoughts?
Beyond the sort of regulations of where data's stored and that sort of thing, the legalities, I don't know. I don't think we do.
No, I think the perplexed looks, I think, are more that doesn't enter into the procurement processes, doesn't enter into any of the decision making other than standard IG and making sure that it's UK based. But Francesca.
I was just going to say, harping back to the visions and being aligned, visions and values type thing. So no, we don't treat you any differently depending on if you're UK or not. But I did see a supplier the other day, and it was very much based on their kind of US health insurance model, which understandably that's the market they operate in. But it just didn't translate in the way they were kind of pitching it here. So I would just say, although we don't treat companies differently, we are a different market, so just pitch accordingly, really.
Okay, I've just been through my list of questions. We've asked all the difficult ones. The audience has been fantastic. Thank you very much. And let me finish by saying it's really, really easy for me to be the National Director overseeing the development of the NHS App and NHS.UK, because we have people like these guys on the stage who are absolutely outstanding and have made the NHS App the success that it is. Please do spread the word. Tell people what functionality is available on it, and keep up the good fight. Round of applause for the team, please.
Thank you so much. And can I just say a personal thank you to the team for what they've done for the NHS. It's something we should be really proud of. But we wish you well for the next 5 years, right? Thanks, Joe.